Hey guys, welcome back to my channel. It's Paris from Project Penelope and Family. So today I just want to talk to you about something that I have happened, and I didn't really know if it was a good idea to talk about it, but I didn't actually have a clue what was going to happen and know what was going to happen with the scans. So I'm 25 years old and I went to the doctors and I felt a lump and it feels just like a frozen pea. The doctor was just like, I'm not really sure what it is, it's on my right side, I'm not really sure what it is, but let's just go and give you an appointment at the breast clinic just in case. Obviously you don't normally have scans until you're 50, I believe, but it runs in my family, breast cancer, so I got checked and today I went for my appointment. So I haven't been able to sleep really for the last 2 weeks. My anxiety has been sky high. I haven't been able to really think straight because I'm just so worried, because I think you naturally just think that it's cancer, especially because it's solid. Anyway, so I went to see them and basically you sit there, and it was about 40 minutes after I sat there I got called in from the time it was meant to be, and the consultant lady was really nice. She was just asked me a few questions and why and how I noticed it, how long it's been there. So I went into another room and you have to take your whole top half off and then you get a gown, so you have to have the opening side of the gown at the front so obviously they can feel. So she felt my left side that isn't painful or has a lump, and she said it feels fine. And then you get really nervous, you can't remember where the lump is, and can't feel it when you're really panicky. Anyway, she was like, don't worry if you can't feel it, I will be able to find it if it's something to worry about. So she felt it and she said, oh yeah, and I had explained that it gets stuck in between the ribs, so I thought it would be like 1 centimetre. So she felt around and she said, yeah, I can feel the lump, it's there. She said it does feel probably hormonal, because you've been on obviously contraception pills and stuff like that. So she said, what we're going to do is we're going to give you an ultrasound just to report back to your doctors, and yeah, honestly it feels okay to me. It doesn't feel really sinister. So I went to the ultrasound department. They're like, it's going to be about an hour. Got a tea and a coffee because there's a little Costa in the hospital, and I was just like, right, okay. So I kind of chilled out a little bit because she seemed to think it was hormonal, and that kind of made me feel a bit better. They do go by age, so if you're below 40, they say it's really hard to get breast cancer, but I don't really like that because it's just like anyone can get cancer, it doesn't matter what age you are. So it is a bit annoying when people put you in a bracket of being 25, so it's really unlikely when anybody can get it at any point in their life, even if they're young to old and things like that. So anyway, I did feel a little bit better. So when I was sat in waiting for the ultrasound, it was about an hour, and went in, and you have to basically obviously strip off from the top upwards, so the jumper and everything had to come off, and the bra. So I led down, obviously it was covered, and you had a nurse in there, and then you had 2 men. One was the doctor, one was the ultrasound, I want to say sonographer, something like that. Anyway, so they were looking and they said, where was it? And I had to put this, there was this big block like this of jelly. It was like a jelly block that you had to put there so it's easier to see on the ultrasound, especially because they're really little. So I was led there and he was like, oh, I can see it. He said, have you had an injury lately? And I said, no. He said, have you knocked the breast? I said, no. I said, I've only noticed that there was a lump there because it's been hurting me. He said, right, okay. So the doctor said to the ultrasound guy, right, you need to move over, I need to have a look. So he moved off the seat and the doctor looked, and the doctor's looking, and he said, right, okay. He said, I can see it might be a cyst, I'm not really sure. He said, what we're going to do is put anaesthetic into, I think it might have been a local, so basically I'm awake and it's fine, just so you don't feel it. And what we're going to do is try and drain it and see if it's a cyst. And I said to him, it's really hard though, I don't think it's fluid. He said they can be really hard and it is just fluid, and it's kind of like sunflower oil when it comes out. Anyway, so I had the syringe put in, and he said it might sting a bit, and it really did hurt, honestly. But after that it went completely numb. So he tried to, basically he got the ultrasound little machine thing, and he was looking to see where the lump was and put a syringe into the lump and tried to drain it. He tried like for a good few minutes, nothing was coming out at all, and I was kind of like, oh, I didn't think there would. Obviously you're hoping, because then you definitely know it's a cyst. So I was a little bit panicky, and I was like, right, okay, just calm down. So I was just trying to calm myself, and then he said, I honestly, on the ultrasound, it doesn't look like cancer and what cancer looks like, but I don't know what it is. So he said what we need to do is take 2 to 3 biopsies, and he said basically it's just an instrument, it's going to go into the hole that I've just made while trying to suck the fluid out, and basically going to take 2 or 3 samples and we'll send it off just to be on the safe side, because I don't actually know what it is. I can't, he said, I don't really know, because if it was a cyst, most of the time it will come out with the fluid. So it is, so he measured it, and he said it was like 5 millimetres. He did say it's roughly about 7, and then he said let's measure it. So he measured it and he said it's 7 millimetres, and it obviously is a solid mass because it wouldn't come out. So that had already set me off a bit, like, oh gosh. But I just tried to remain calm, because everyone in the room was just like trying to ask me about my job and just to like distract you really. So I then was a bit, oh gosh. But I mean, you want to be safe than sorry. So I basically sat there, and he put an instrument in. He's like getting the nurse to like press really hard on your boob, because when he put the syringe in, it starts making you bleed a little bit. So I remember I just felt like loads of pressure, because obviously she's trying to stop the bleeding while he's putting this bigger instrument like this in and just sucking out a little bit from the hole while trying to look in the ultrasound to make sure he's actually getting the lump. So he took, in the end, what happened is he's like, right, you're going to feel like a little bit of a staple. So you don't feel it, but you're going to hear it's like a staple noise, and it presses quite hard on you. So basically I was lying down, and then you got this massive like staple noise, and he actually done 4 biopsies. So he took it out, put it in a little thing, like little glass thing, and then he redone it again 4 times. So I was a little bit like, oh, because I was like, right, 3rd time he said 2 to 3 it's done, and then he said 4 times. He said, and then afterwards he said, oh, like, all the best, you should get your results within 2 weeks. And he said that normally if there's nothing really to say, they will ring and just tell you your results, or you'll have to go in. Then the nurse afterwards was just like, look, you normally have to come in anyway for the results. He said that sometimes if the lump is a solid mass and it's something different to what you do, he said that basically you would need to go and maybe have it removed. He said sometimes they like them to be removed. He said it doesn't look to me like cancer, but we need to just make sure that we know what it is, because he said I don't really know what this lump is because it is a solid mass. So I basically had a dressing put on, so they have to basically hold it there until the blood stops, and then they dress it, and basically after that you get a little note, and basically it says what happens next. It says the procedure you had done today is called a core biopsy. A small amount of tissue has been taken for examination. The area has been dressed and should be left clean and dry for 48 hours. So she said that you can have a bath from downwards, but you need to like flannel obviously the top and keep it dry. It says the covering dressing should be removed, and the steri strips underneath can be gently taken off if the wound looks healed. The local anaesthetic used will gradually wear off over the next few hours, and they said make sure you have paracetamol as soon as possible afterwards, because it does start to wear off. It is aching, my boob is really aching. If the pain relief is required after this, paracetamol as per the pack instructions or a cold dry compression may help. It is normal to have bruising to the breast following the biopsy, and it may take a few weeks to settle completely. If you're worried about the bruising, please seek medical advice. Avoid strenuous activities including lifting for 24 hours. If the dressing are causing the skin to become irritated or inflamed, please remove it. If you have further questions, please call blah blah blah. If you have not already given an appointment to return to the Ladybird unit for results, you will be contacted within 3 weeks. You will receive an appointment by post. So I am a little bit confused because I'm thinking the doctor said if it wasn't bad they'd just ring you, and then the nurse said they normally always get you to come into the clinic, so I don't know. I think I'm just going to be really worried, but I just wanted to explain to you my experience. Like, they were lovely. I think you just get really scared, and especially when you're younger you don't actually know because you don't have these. Like, we hear about cervical screening now because it's been brought down younger, but we don't actually hear about breast screening because we don't have it at this age. So yeah, I'm a little bit worried. I keep thinking my back hurts and stuff, and then you're thinking, what about if it's cancer, what about if it's spread, and I don't know. I think you just have so many things going on, but I just wanted to like talk about it. I was a bit wary about talking about it because I just thought maybe I just shouldn't, and I just want to know the results. So he did say within 2 weeks you will hear. But yeah, I think it's really scary, and especially at this age when they just tell you statistically you shouldn't have breast cancer and it's really low, that I think everybody, even if you're really young, should just get checked, because it doesn't matter how young you are, you can potentially get it at any age. And we are going to go down the route of, because my auntie has had it and my other auntie had cervical cancer, we are going to go down the route of seeing if we've got the gene, because it's just so important. We've got so much history, and I don't think that doctors should just be like, well, because your age you probably haven't got it, when you just don't know. So please make sure you check your breasts. Like, honestly, for me, I'm really worried. I really hope it turns out okay, but there's others that will think I'm 25, I'm 20, I'm 30, I won't have breast cancer because statistically you won't get it and it's very low. I just think, just if you've got any concerns or thickening or anything, just go and get it checked. So just before, I'm going to quickly show you, not the actual boob, but I'm going to show you the below bit of how they've stitched it and what it looks like. It is starting to wear off, it is starting to get a bit painful. So yeah, it's a bit hard when they say don't lift anything when you've got a 1-year-old, but it's fine. But yeah, I just wanted to let you know kind of what my experience is like and what actually happens, because a lot of people don't talk about it and there's not enough awareness. So please check your breasts and just go to the doctors. If they suspect anything and they're not really sure, they should 100% send you to a breast clinic to get checked. So please just go, and if they don't send you and you're certain you can feel something or thickening or your nipples being inverted, please go and get a second opinion, because like the consultant to me said it was fine, and then you just need an ultrasound basically just to be sure, for the doctor's notes and stuff, and then the ultrasound, like the sonographer and the doctor was just like, I don't know what this is, we need to make sure we do some biopsies. So you just don't know. But yeah, I hope this helps somebody else, so please go and get it checked. I'm going to quickly show you what they've done. So after they do that, you basically right on the side, and it's that. So yeah, I'm not allowed to get that wet, so that is basically what happens. But I really hope this helps somebody, and if you are concerned and you felt something at any age, please go and get it checked. Anyway, I hope you enjoyed my channel, and I will keep you up to date with what is happening. I literally am so worried. I hope it's not 2-week wait, but then you're thinking, if they ring you in the next few days, is it cancer, is it something bad? You just don't know. But I will keep you up to date. Have a good evening.